Breast cancer is most often associated with having a breast lump. However, your symptoms may vary depending on your specific type of breast cancer. While it's true that many patients have a lump, it is possible to have breast cancer with no lump. So it's important to know the other signs and symptoms. In general, the body produces certain warning signs. The most common is the breast lump, which may be located anywhere along your chest wall to under your armpit. You may have nipple bleeding or discharge, as well as related pain. There may be redness and/or swelling in any area of the breast or in one breast and not the other, and your nipple could look flatter or caved in. Having some of these symptoms or breast changes doesn't necessarily mean you have breast cancer. Many other factors go into a diagnosis, not just outward signs. Early detection of breast cancer is key when it comes to breast cancer treatment options. What is a normal breast? No breast is typical. What is normal for you may not be normal for another woman. Most women say their breasts feel lumpy or uneven. The way your breasts look and feel can be affected by getting your period, having children, losing or gaining weight, and taking certain medications. Breasts also tend to change as you age. For more information, see the National Cancer Institute's Breast Changes and Conditions. Common symptoms of breast cancer include a lump in your breast or underarm that doesn't go away. This is often the first symptom of breast cancer. Your doctor can usually see a lump on a mammogram long before you can see or feel it. Swelling in your armpit or near your collarbone. This could mean breast cancer has spread to lymph nodes in that area. Swelling may start before you feel a lump, so let your doctor know if you notice it. Pain and tenderness, although lumps don't usually hurt. Some may cause a prickly feeling. A flat or indented area on your breast. This could happen because of a tumor that you can't see or feel. Breast changes such as a difference in the size, contour, texture, or temperature of your breast. Changes in your nipple, like one that pulls inward, is dimpled, burns, itches, develops sores. Unusual nipple discharge. It could be clear, bloody, or another color. A marble-like area under your skin that feels different from any other part of either breast. Breast cancer types. Healthcare providers determine cancer types and subtypes so they can tailor treatment to be as effective as possible with the fewest possible side effects. Common types of breast cancer include invasive ductal carcinoma. This cancer starts in your milk ducts and spreads to nearby breast tissue. It's the most common type of breast cancer in the United States. Lobular breast cancer. This breast cancer starts in the milk-producing glands in your breast and often spreads to nearby breast tissue. It's the second most common breast cancer in the United States. Ductal carcinoma in situ, like IDC, this breast cancer starts in your milk ducts. The difference is cyst doesn't spread beyond your milk ducts. Less common breast cancer types include triple-negative breast cancer. This invasive cancer is aggressive and spreads more quickly than other breast cancers. Inflammatory breast cancer. This rare, fast-growing cancer looks like a rash on your breast. IBC is rare in the United States. Paget's disease of the breast. This rare cancer affects the skin of your nipple and may look like a rash. Less than 4% of all breast cancers are Paget's disease of the breast. What causes breast cancer? Experts know breast cancer happens when breast cells mutate and become cancerous cells that divide and multiply to create tumors. They aren't sure what triggers that change. However, research shows there are several risk factors that may increase your chances of developing breast cancer. These include age, being 55 or older. Sex. Women and people AFAB are much more likely to develop the condition than men and people AMAB. Family history. If your parents, siblings, children, or other close relatives have breast cancer, you're at risk of developing the disease. Genetics. Up to 15% of people with breast cancer develop the disease because they have inherited genetic mutations. The most common genetic mutations involve the BRCA1 and BRCA2 genes. Smoking. Tobacco use has been linked to many different types of cancer, including breast cancer. Drinking beverages containing alcohol. Research shows that drinking beverages containing alcohol may increase breast cancer risk. Having obesity. Radiation exposure. If you've had prior radiation therapy, especially to your head, neck, or chest, you're more likely to develop breast cancer. Hormone replacement therapy. People who use hormone replacement therapy have a higher risk of being diagnosed with the condition. Can breast cancer be prevented? You may not be able to prevent breast cancer, but you can reduce your risk of developing it. Just as important, regular self-exams and mammograms can help detect breast cancer early on, when it's easier to treat. How do I take care of myself? Living with breast cancer may not be easy. You may have days when you feel overwhelmed by your situation. Consider the following suggestions for taking care of yourself as you go through breast cancer diagnosis and treatment. Get enough rest. Breast cancer and treatment can be exhausting. Try to remember to rest when you need to, not just when you think you have time. Eat well. Treatment may affect your appetite. A diet of fruit, vegetables, lean protein, and healthy grains can help you stay strong during treatment. Manage your stress. Cancer is stressful. Exercise can help, from regular walks to exercise programs. Find support. You're a breast cancer survivor, starting the day you were diagnosed. Ask your healthcare provider about cancer survivorship programs, which may help you manage some of the challenges that come with living with breast cancer.